we have an exciting panel of caregivers, care partners, to really just give us an in-depth discussion about what that looks like and give us their perspective. So looking at our agenda, we have 3 speakers today. We have Jeff Nelson, Verneeky Jackson, Sonja Hoffman, and then we'll have questions and answers. Jeff Nelson is going to start us off. He is an ESRD patient with polycystic kidney disease. In 2013, Jeff started hemodialysis, and in 2014, he received his first kidney transplant. That kidney eventually failed, and he received his second kidney transplant in 2017. Jeff currently serves as the chair of the Network 11 Consumer Committee, is a member of their board of directors, and provides support for kidney patients and advocacy for state and federal legislation. We're so thankful to have you here today, Jeff. Thank you so much. I'll hand it over to you.
Thank you, Emma. Thank you very much. So yes, as Emma mentioned, my name's Jeff Nelson. I have polycystic kidney disease. For those of you that know much about PKD, it's a hereditary, a genetic disease, so it runs in my family. My brother and I both had it, and we inherited it from my maternal side of the family. And I spent about 4 years in dialysis. And as Emma mentioned, I had those 2 kidney transplants. My first one was my living kidney donor from my cousin, but that didn't work out. And then I was back on dialysis for a couple of years, and then I got that very special call from my local transplant center that they found a kidney for me, and it's been upwards and onwards ever since then, and that was 6 years ago. So very, very grateful and thankful. Emma, can you go to the next slide, please? So the way that this, the whole project kind of got kicked off earlier this year is that in January, the Center for Medicaid Services asked all of the networks to start working on some projects to, help support the key CMS goals and initiatives. Some of those initiatives included a home dialysis, transplant, depression, reducing readmissions and ER visits, and other topics. Our executive leader or director for the Midwest Kidney Network challenged our consumer committee to help, to kind of lead this project, to, find something that, find a way to kind of get the message out and help the kidney community. Can you go to the next slide, please? So so after the challenge from D, the consumer committee met. We had a couple of meetings this spring, both together as a whole committee, but we also kind of split up our committee into smaller groups so that we could focus just on this project. But when we at the bigger high level consumer committee meetings, we kind of kicked around some different ideas about, where would we want to focus? What would be the best way to get some of this messaging out? Things that we talked about were like an outdoor billboard or an indoor poster of some sort. Both of those have been successful. At least I can speak to the outdoor billboard. I used an outdoor billboard to find my first kidney donor in the Milwaukee area, and that worked out really well. And the indoor poster has worked really well for our another national program called Fistula First, which, when I was in some clinical studies and stuff at the Mayo Clinic back in the that was almost 15 years ago. I remember these Fistula First posters on the wall. So, a great way of kind of, getting some message out and keeping it in front of people. We considered about transplant kidney care, awareness about high blood pressure and how to identify patients or depression in patients. Next slide, please. So I mentioned about how we formed those subcommittees, and so we got some volunteers from our consumer committee meeting. We met a couple of times in February. We came up with some ideas. It seems that a lot of times, the social media is kind of the go-to. It's like, well, it's almost an easy button to push. It's effective. I mean, don't get me wrong. I mean, it's, there's a lot of different ways to, get stuff out on social media, depending what vehicle you're using and what kind of media you've got to present. Facebook Live presentation was kicked around. Another consumer committee member in Michigan has been very successful with a prior Facebook Live presentation that they did. We also talked about, focusing on supporting home dialysis patients, because a couple of our consumer committee members, they had firsthand experience with that home dialysis part, which, when we started talking about that home dialysis part, it kind of led to the whole caregiver care partner situation, because the folks on our committee, at least two of them had this very strong and deep experience with being a care partner for a loved one, and being that person that was being cared for as well. So kind of both sides of the coin. So from a distribution standpoint, what we settled on was that we would come up with a trifold brochure, and the trifold brochure would would communicate these ideas and resources, and kind of get keep, it would be something that would be easy to distribute through a PDF file, and we can get this out to the dialysis clinics and to social workers and things like that. Next slide, please. So let's talk a little bit about the difference between caregiver and care partner. When we started planning the trifold, and throughout the trifold, everything was referred to as a caregiver. But as we started going through some of the peer review with the trifold, it was suggested that maybe we'd consider using the word care partner. And right away, as soon as I heard that recommendation, it kind of resonated with me, because there's a real difference between a caregiver and a care partner. I mean, a caregiver gives care, but the care partners are, you're more of a, it's no longer a hierarchical relationship, where the caregivers, like a nurse would be giving care to the person receiving the care. Just kind of changing that term really kind of changes your perspective from that hierarchical relationship to the equal footing partnership, which I think is really important, especially when we're dealing with all the family dynamics and things. When we look at where care partners kind of fit into most situations, those too often it is a family member, and by starting to use that term care partner, it kind of creates a more equal equal balance in that relationship. Next slide, please. So who are all, when we talk about care partners, there's a lot of different care partner opportunities, and kind of depending on where you are in your stage of life, what kind of family relationships you have, or friends and stuff like that. So in some cases, you may be a home care staff. I myself, I live in Wisconsin, and Wisconsin has each Wisconsin county, all 72 counties, have what's called an ADRC, community center, so Aging and Disability Resource Center. And the Wisconsin ADRCs are, if you needed help, with home care, and you would get a referral to that ADRC, and then you'd partner with one of their social workers, and then they would help to find exactly what kind of need you may have in terms of home care. So they would, if you're elderly, for example, maybe you just need, help with some help around the house or shopping, they could help you get hooked up with some of those resources. So when we talk about, renal disease, there's a lot of different situations there. You've got, home dialysis, home peritoneal, home hemo, in clinic, and we'll talk a little bit about that in some of the other slides. So you may have a referral where you have, like, home care support staff coming in from outside. But as I'd mentioned before, a lot of times it ends up just being family members. Family members take care of loved ones. I mean, it's in a lot of ways, it's just kind of as simple as that. Speaking for myself, I have a developmentally disabled young adult son. He's going to constantly need care, throughout his entire life. And so, as a father, and my wife as his mother, we found ourselves in a lifelong care situation like this. And my wife also had to kind of take care of her dad for a number of years while he had some COPD issues. And so this, I think a lot of times we just simply find ourselves, whether voluntarily or not, you kind of find yourself in that kind of a care partner situation. And like I said, a lot of times it just ends up being, the closest family member, or the one that's most able to help out, for different reasons. One of the things that's really important to remember is that, not all heroes wear a cape. And the thing is that care partner, it's a kind of a role, and I'm sure those of you that may already be in a caregiver a relationship with someone at home understand exactly what I'm talking about. I mean, you're the hero. You're the one who shows up on time. You're the one who shows up for the appointments, and you're the one who says, I'll see you tomorrow, and they can count on it. And you're heroes, and that's super important. Next slide, please. One of the biggest problems with that we found out while we were talking about what it's like to be a care partner, and the research that I had completed online is that it leads to a lot of stress and burnout. That what I'd mentioned just a moment ago about I'll see you tomorrow, that commitment that you're going to be there tomorrow, or later that evening, or at the end of the dialysis run, or whatever. That emotional bond and commitment that you have, it directly or indirectly, it a lot of times it leads to burnout. And it leads to burnout because of that commitment, the fact that those the people that you're taking care of, they may not necessarily be on a road to recovery and getting better. Certainly, we hope they do. But when it comes to end-stage renal disease, if your renal disease is chronic and not acute or temporary, but when we have chronic kidney disease, it's there, and it doesn't go away, and it doesn't get better. I mean, there's when it comes to kidney disease, we start looking at treatment options: peritoneal dialysis, home hemodialysis, or transplant, and those are typically our three top options. So the caregivers end up being faced with or developing a lot of stress, and that stress leads to burnout, where it just seems like this job just isn't gonna end. So it's and especially, like I said, with the last bullet point about how folks with end-stage renal disease, they may need help over that longer period of time, and it usually may end up being years, and so there can really be this really long commitment, and feeling like, boy, this just isn't going to end. Next slide, please. So one of the things that we wanted to emphasize in our brochure is, for someone who picks up the brochure and starts to look at this guide to caregivers, when you open it up, we want them to kind of look at this and start to say, what kind of signs, do these signs of feeling overburdened, making mistakes, or stressing over making a mistake, the fatigue and mental exhaustion, do any of these kind of resonate with a care partner? Because the idea here is that we want people to recognize some of these symptoms, which can lead to their own. We don't want to create more health problems, and we certainly don't want to lose that care partner and have them burn out or get sick or something like that. So listing these key bullet points, which were emotions and feelings that folks on my team had shared with us in terms of developing this brochure, that they felt during this experience, and they continue to, because they're continuing to take care of their father or their sister, whatever the situation was. And the other thing too is that this often leads to these relationship issues, because directly or indirectly, the person that's being cared for, they need help, and sometimes they can be, we can all, day after day, we all don't feel exactly the same way every single day, and as much as we talk about caregiver burnout, sometimes the person being cared for can also kind of get burned out. They're going through dialysis every single day, or maybe every other day, depending on your regimen. So there's it can create these relationship challenges, and especially it can really strain a relationship, no matter whether friends or family, or if it's an outside caregiver, that some the necessary the strings that bind that relationship together may not be that strong, and it could be strained or stressed. So. So these were some of the signs and stress and burnout, again, that we wanted to be part of that brochure. And if you felt this way, you found yourself crying and feeling it was never going to end, maybe we could move on to the next step. Let's look at the next slide and look at some of the ways that we could address some of those signs of, or dealing with some of the stress and burnout. So the next slide, please. So some of the tools and ideas that we suggested that for managing your caregiver burnout is just like a lot of other things. You really got to admit that you need help, and it's it may not come easily, and it may we're hoping it would come as soon as you pick up the brochure and you look at it and you go, wow, you know what? All these things the stress, the anxiety, the crying, feeling like it's never going to end. These things really, that sounds like me. And maybe I need to get some help, but I don't know where to go, and I don't know what to do. But what's really important is that you take that first step, admit that you need help, take care of yourself, and reach out for help, and share and find a way to kind of share that work. Again, referring to what we would do here in Wisconsin with we can get help from the ADRC. There's a number of other organizations, both state and local, that we can engage in to get help, or it may be also depending on family relationships, if those are available. You can also try to bring in other care partners into it. The thing is that a lot of times the caregivers and care partners end up being just a singular person who's doing that work, and they're the ones that you count on, and they're the ones that are there every day, and they're the ones that take for appointments. Even getting some time off, switching days, can really change the dynamic. We all need breaks, right? We can't work 7 days a week. And unfortunately, a lot of times that's where our care partners are called upon. Another way too to help kind of manage that burnout and that stress is just to simply join a support group. And myself, I found that working with support groups like for kidney disease or transplant, sharing things that we've gone through, sharing ideas and things like that, really go a long way towards helping helping how you feel. It kind of acknowledges how you feel. Other people are talking about this, how they feel, what they've run into. You say, yeah, that's me. Here's what happened to me. Here's how I dealt with it. And then by getting some of those ideas from some of the other care partners and caregivers, you can, take better care of yourself, and maybe get some ideas about how to handle things better. Next slide, please. When we look at end-stage renal disease and the care partners with that end-stage renal disease focus, we talk about, there's, as I mentioned before, end-stage renal disease, it's a chronic condition. It isn't going to heal. It's not going to go away. And we end up typically with three main modalities of treatment. It's either going to be like a home dialysis, a peritoneal dialysis, or like an in-clinic dialysis, unless you get a transplant, and even that's another form of treatment. It's not a cure, and that comes with its own issues. So, kind of talking and focusing a little bit about a care partner with end-stage renal disease and home hemo. What our committee, the members in our committee, shared with their caregiver experience is that they needed to be there the whole time during the dialysis treatment. just like if you're in clinic and you've got, staff, I mean, they may be walking around and taking care of other patients, but typically you're part of a quad or a couple of other patients that are in that area, you're being supervised. And as a treatment goes on, myself, I know I can speak to a couple times where my dry weight was dialed in a little too low, and we ended up taking off too much water, and I started feeling groggy, and I think I passed out or something. I just remember the dialysis tech coming up and saying, Jeff, how many fingers do you see? But there's a lot of things that can go wrong, during home hemo, and you've really got to have that caregiver there and care partner, throughout that treatment. Another thing was about the home hemo, setting up the machine, cleaning the machine, the cannulation. There's a lot of steps that go from that beginning to end of a home hemo treatment. And if you're doing it at home, and depending on if you're as the patient with home hemodialysis, depending on your strength and your abilities, you may not be able to do some or any of those things. And so that's going to end up being your care partner that you're going to be counting on to get some of that stuff done. Another thing with home hemo was about purifying water for dialysate. Folks that I've met that have home hemo, this is something that absolutely has to be done, and it isn't something as simple as turning on the faucet. You've got to run through a reverse osmosis in most cases. It's slow and it takes time, to build up enough of the water that can be used for dialysate that's ultra pure, and you've got to have that ultra pure water. So there's and last but not least, organizing supplies, and this really seemed to be a real key thing that care partners ended up helping family members with, because when these supplies came in, and I know when my mom was on dialysis and she had peritoneal at home, the guy from UPS would show up, and I think the entire truck had everything for her for the next month, and the guy was bringing in just hand trucks full of the water, the dialysate for her peritoneal, and stacking them up in her bedroom, and it was literally up to the ceiling. It just said Baxter all over the bedroom, and it was just a lot of supplies and a lot of tubes and a lot of stuff, and so receiving those supplies, making sure that the oldest stuff gets used next and the newest stuff goes behind it, and keeping supplies handy right next to the cycling machine or the home hemo machine. It takes a lot of effort, and a lot of organizational skills. So again, this ends up being kind of that big picture of home hemodialysis. And maybe after the presentation here, we can talk a little more about what other folks' experience has been when it comes to home hemo and being at that care partner role. Let's go to the next slide, please. So when it comes to clinical dialysis, and this has been where my own personal experience had been, is because I was, for the 4 years that I was on dialysis, or almost 4 years, I did everything at a nearby clinic, and thankfully it was nearby. I mean, for me, it was only like 12 miles away. But one of the biggest issues, I think, really from that, even with the clinical dialysis, was transportation. Thankfully, I was healthy enough and I was able to drive myself to and from the clinic. But sometimes, when I was done with treatment, coming home, I was a bit spaced out. It was I would I was on the clinic I was going to was on a major highway in the west side of Milwaukee, and I would basically just wait for all the traffic to clear, get in the right-hand lane, and just kind of take it easy and stay out of people's way and have both hands on the wheel, because should I have been driving? Well, I don't know. I mean, I guess it's I felt that I did certainly get home okay every day, but I know a lot of other folks that were at that clinic, they were getting rides from other care partners, husbands, wives, stuff like that. The other thing about clinical dialysis is that you get these weekly blood tests, and understanding and interpreting what those blood tests mean, and what the next steps are going to be. One of the things that I found is there's just a hand in glove relationship between the labs that came back and my diet at home when I was on home hemo. So in other words, if I had any sort of a high potassium, like a fruit or something like that, it would immediately show up in my labs when they did them on Mondays. So I would, thankfully, my care partner, my lovely wife, she really helped me out a lot with managing my potassium and managing my phosphorus, which are some really, crucial elements that need to be maintained and managed if you're on any sort of a dialysis regimen. So managing those dietary restrictions was really part of my caregivers, my care partner, and how she helped me maintain a healthier lifestyle through diet, and then that healthier diet led to better lab results, which led to a more successful outcome. So I was really thankful for as many years as I was on dialysis, and when my transplant did come, and then they found that my veins and arteries, did not have significant calcification, and so I was still a good candidate for that transplant. So it's kind of like one of my sayings about transplants is, eyes on the prize. I mean, you've really got to be ready, at all times if you're in a transplant list. And this, I think, is diet and managing your labs is a big part of it. Let's go to the next slide. As a transplant patient, there's still a lot of post-transplant care that needs to take place. And again, this is where we need to engage with our care partners. There were so many follow-up visits after my transplant, and in fact, somebody, one of my friends had said, well, she has a friend that is looking at listing at multiple transplant centers. I said, well, that's great. I said, but being listed at a faraway transplant center can really come with its own challenges and issues from a logistics standpoint. So having a care partner really at every post-transplant follow-up visit was important, because I really needed, my care partner, my wife, to be that other set of eyes that was listening, reading body language, my language, the doctors and nurses and PA, to kind of see just, what's really going on and what are the best next steps, and making sure that it was clear just what those next steps are going to be in terms of care, and what I needed to do as a patient, and what, how they could maybe help me as my care partner. The other thing too is that when it comes to prescriptions at post-transplant, everyone's post-transplant medication regimen is going to be different. I think for most, transplant patients, we end up being on tacrolimus, mycophenolate, and prednisone. For me, though, I mean, I end up, because of I've got low magnesium, I've got low phosphorus, I've got high calcium, so my PTH is all out of whack. I end up taking literally 30 pills a day. So when it comes to filling pill boxes, it's a chore, and it's like a maraca. I mean, I've got so many pills that I take every day. So it's managing those pills, managing that pill box, making sure that I got the right stuff on the right day. It's really, really important. And you know what? Even though I've got my iPhone and my watch and I've got all this stuff reminder set up, my wife still reminds me, hey, did you take did you take your medication tonight? Because she didn't see me get it from my chair or something like that, and she didn't know that I took it a little early. So all of these things kind of go to how our care partners can help us with our post-transplant care. Let's look at the next slide. So this is what our brochure looks like. This is so if now when you think about this brochure, there are on the left side of the screen here. This is I mean, and I wish I can kind of maybe show you what it looks like on the on my slide here, or on my video, the visual, but it's a trifold, so we kind of fold it up into 3 pieces, and it's and when you open it up on the right side, this is what you see. So, it talks about, who's a care partner, signs of the care partner stress, caregiver burnout, in the middle, about the tools for managing the care partner burnout, and how you can connect with organizations that can backfill and so forth. And then we talk about the home dialysis, in-center clinical dialysis, and post-transplant care and follow-up. So this is what our trifold looks like, and certainly it's a it's a PDF, and we could share this with anybody who would certainly like a copy. Can we go on to the next slide, please? So that's everything I kind of wanted to share about care partners and what our project from the Midwest Kidney Network 11 up in the cities was all part of. Emma, so what's the next step? Do we open it up and have some Q&A?
We do. Thank you so much, Jeff. There's been lots of chatter of people just so grateful for you sharing your experience as being a care partner and as also being a transplant patient, dialysis patient. So many folks appreciate the use of care partner versus caregiver. We did drop the direct link to the PDF in the chat so people are able to view and download the brochure. One of the questions I know that's going to come up at some point is if the brochure is available or will be available in Spanish or other languages. Do you know?
Well, that's a great point. Actually, I think I remember thinking about that. I was probably watching TV and I didn't send myself an email as a reminder, and I probably forgot about it. But that's a great idea. I guess here would be my response. My Spanish language skills are at best survivor language skills. I can find where the restroom is and order a couple of beers. But if there was anybody who is in this program this afternoon that would have language skills and would help me work with doing the appropriate transliteration so that we get to communicate the right message to that Spanish speaking audience, that would be awesome. I'd love to transliterate this brochure into Spanish or any other language, because certainly English is not the only language that we use here in the US.
Absolutely. Well, we'll send that out there. If anyone reaches out, we'll let you know.
Thank you.
One of the other questions that came through was just about your consumer committee project in general. Are you all planning to have another project? I know you listed some of those other ideas, the billboard, possibly a video. Are you all working on others as well?
Not yet. However, our work would seem to almost never end. But we have actually tomorrow on Thursday, the Consumer Committee for Midwest Kidney Network 11 will be meeting up in Bloomington, which is a suburb of Minneapolis, and we're having our annual meeting to come together as a group and get a chance to meet people, meet folks in person. We've been meeting virtually now for years. This will be our first in-person meeting since before COVID. But this is actually going to be one of our main discussion points is, let's come up with another idea. What's that next project going to look like? And maybe we'll be, even more ambitious than we were on this project. But yeah, we will be starting a new project for 2024.
Great. Well, we are definitely excited to hear more about what you are doing. This brochure is wonderful. I'm sure you've received some excellent feedback. It's clear in the chat that people are excited to see this and use it. So we're looking forward to hearing what other feedback you are receiving.
Okay.
And then the last question that came through is more just from your experience of being a care partner yourself and having a care partner. For someone who is just getting started being a care partner for a loved one, what recommendation, what words of wisdom would you share with them?
Well, my first thought is to be patient and be understanding. And that would be my first thought, is to be patient, be understanding. The second thought is, don't try to go this alone. This is, if you're going to be taking care of, or helping be a care partner for another loved one or someone with end-stage renal disease, this may end up being a very long-term commitment. And I think getting some backfill right away, getting some help, other family members, engaging with local resources, state and local, to find respite care, to find somebody else to kind of back you up. you don't want to wait until you are burned out, until you can't take it anymore, or worse, maybe you might even fall or get hurt, and then who's going to take over for you? You need to bring in somebody else into that picture so that somebody else knows what's going on. You can develop a relationship and get things going. So I would definitely recommend a team approach. I think it's going to be the most successful outcome. It's going to be the easiest for you and for the person that's being cared for.
Thank you. And I think that answers this next question that came through of if you had any suggestions on encouraging family members to be care partners or become more engaged.
Yeah, that's kind of tough. I mean, I know that when I'm thinking of particular my father-in-law, and my wife was taking care of him. Thankfully, my wife was she had just transitioned out of being the mother and caregiver for our developmentally disabled son, and no sooner than he became an adult and moved out of the home into a care facility on his own, then her dad needed help. So she was not working, so she kind of became the de facto caregiver for her father. But when we started looking out for help from other family members, the other family members kind of stepped back, and weren't willing to make that commitment. I mean, they helped out a little bit here and there, but this is where the family dynamic becomes kind of complicated, or becomes very complicated, and it's just going to be what it's going to be. And this is where sometimes in a lot of ways it's easier to reach out for those local community and state and local resources, and get somebody who's not necessarily directly or emotionally involved, or not part of that whole family dynamic. It's just you need, but one way or another, you're going to need to get some help, and need to get some help to help you and to help them.
Absolutely. Thank you for pointing out how every situation is so different, and it's important to look at it and in its entirety and to make sure it's a good fit for all.
Exactly.
Well, Jeff, we are so thankful for you being here today. We're thankful for the Midwest Kidney Network for sharing this beautiful brochure. We will continue to watch the chat. If more questions come through, we will send them your way.
Okay.
Thank you so much for being here.
Thank you, Emma, and thank you for everyone for being here today in this presentation. Good luck.
Thank you. We are going to move forward, and we have a few other caregivers that are going to provide us some wonderful insight. Before we get to them, we wanted to highlight our Peer Caregiver Connection call series. This is a call series that we have on a quarterly basis. They are free, they are open to all, they are patient and care partner led, and they bring folks together who are affected by kidney disease. And the whole goal is for attendees to gain insight from hearing the challenges and successes of others who have similar kidney health experiences. So participants have an opportunity to speak directly to and ask questions of the panelists, and just learn how they can improve or change their current situation. So on the next slide, we have our date for our next call. It is not until 2024, but mark your calendars. We will be sending out an invite probably in the coming weeks to month. It's Thursday, January 25th, 2024 at 4 p.m. Eastern. Again, this is open to all, and it's virtual as well. So we will be sending out that information shortly. If you yourself are a care partner and or a patient within the ESRD community and you would like to share your story, please reach out to us. We would love to engage with you and include you in these series. On our next slide here, we have a few patient and care partner resources that we like to highlight on our website, ESRDNCC.org. These are beautiful tools and resources that have been developed by patients and care partners for patients and care partners. So you really get that first person perspective. And they cover the gamut of depression, home dialysis, hospitalization, and really just dig a little deeper into ways to support your care partner and ways to support the patient. The next slide has a few examples of what these look like. So the one on the left, tips for kidney caregivers. These are just very straightforward, realistic tips on being a care partner and things to keep in mind, a good checklist for yourself. And it includes the second page that you can add important medical information to help you keep track of all the different details and appointments, because there can be quite a bit. On the right-hand side here is a really great resource that explains how dialysis can make certain people feel and what suggestions they have for you as the care partner, whether it be just letting them sleep, asking them if they're okay, getting them food. So kind of like a little cheat sheet on tips to help you communicate a little bit better. This is a QR code, so you're welcome to utilize that. But as always, you can find these resources on our ESRDNCC.org website. Up next, we have our two care partner panelists, Verneeky Jackson and Sonja Hoffman. Verneeky Jackson comes to us from our ESRD Network 5. She has been a caregiver officially since June of 2012, which was approximately when her mother, Verneeky Jackson, was diagnosed with ESRD. And she has been involved in our NPFE land since January of 2021. Sonja Hoffman has been a caregiver for her son for 11 years while he was on in-center dialysis and then home hemodialysis. She also volunteers with animal rescue groups like the CAT TNR program. She is currently a member of the Home Dialysis Affinity Group and our Legacy Group. Verneeky and Sonja, welcome. Thank you so much for spending some of your day with us.
Hello.
Hi.
Good afternoon, everyone.
We are so thankful to have you here sharing your experiences about being a care partner. For the other attendees, we encourage you to use that chat feature to ask questions as we go through this presentation. Sonja and Verneeky are very open to answering any questions or comments you might have. I'm going to get started with Verneeky. If Verneeky, you want to tell us just a little bit more about your role as an ESRD care partner to your mother.
Yes, absolutely, Emma. I'd be happy to share that information. So by career profession, I'm a home health aide and personal care aide, and my roles include many things. Actually, I assist with her activities of daily living, which include meal preparation, cooking, to include preparing special diets like a renal diet, low cholesterol, low sodium, sugar-free. And I'm an escort, personal escort for her on all of her outings, including her medical appointments, to visit her providers, also running business errands when we go out for just leisure time. I transport her to make groceries, pay utility bills, scheduling any maintenance that needs to be done around the home, laundry, housekeeping, cleaning, companionship, emotional support, and mobility assistance. So there's many things I do on a regular basis.
Absolutely. That is quite the list you have there. Thank you for sharing that. Can you tell us a little bit about how you coped adjusting to that role of taking all that on?
Sure, I'd be happy to share that. So in coping, it was a challenge of a transition in the beginning because I came from being active duty military to having to transition to the civilian sector. So it was almost like starting all over again in the beginning. But the military is one thing they taught me is to enforce leadership and to make quick adjustments. So those are some of the skills that I applied coming back into the civilian world. And that was very resourceful for me in getting started.
Okay, thank you. That's definitely quite the transition.
Yes, two different worlds altogether.
Absolutely. I am going to pose these same questions to Sonja. Sonja, would you mind sharing with us your role as a ESRD care partner? What that look like?
Okay, well, in 2006, my son was diagnosed with IgA neuropathy. And the beginning of 2007, of course, the IgA attacked his kidneys and he went into renal failure. The first year we spent him going in center. And the issue was he spent more time in the hospital than he actually did out of the hospital because the treatments he was getting in center just were not sufficient for him. And at the beginning of 2008, we transitioned into home hemodialysis. And that's what we continually did. We started off with 6 days a week. For the first few years, he had a transplant that lasted in 2009-10 for about 1.5 years. And then the IgA also took that kidney. And so we've been on home hemodialysis since. He did 6 days a week for 3 or 4 years, and then we went to 7 days a week. I was working full time. I was working on the road. So it was a big transition going from working all day, coming home, and then dealing with home dialysis afterwards. But you have to find, and it's different for each individual, you have to find some way to get a break mentally. We had a dog and a cat. Pets are a great way to just kind of relieve some of your stress. Not everyone can have pets or wants to have pets, but that was one of our helps for both him and myself. Listening to music, you have to find a time, 15 minutes, 30 minutes, to totally disconnect from the dialysis world for a while and get your mind focused on something that has absolutely nothing to do with dialysis, so that you can continue doing all that's involved from working and doing everything from at home.
Thank you for sharing that. I love that you point out that you utilize pets as a way to relieve stress, and that you were, able to have pets even though you are on home dialysis. A question that came through is, you were in a unique situation of being a parent, obviously still to your son, and then having to transition into more of a caregiver, care partner. Was that a big shift for you and your son, or was it maybe easier than anticipated?
He was living at home. He had some other medical issues. He had Osgood-Schlatter disease, which affects the bones in your knee. It's like considered a sports injury. But he had other medical issues outside of the getting the IgA neuropathy. So he was already still living at home. So it wasn't where I had to go to his house or moving in. He was already living at home. So it made things a little bit easier, being that we were already used to having each other around, so to speak.
Okay, thank you. One of the other questions, and this goes back to, what Jeff was talking about, of having a backup, having a community. Did you have any extra support for yourself as a care partner, as either a backup as a caregiver, care partner, or just as a support for you?
Is that a question to me or to?
Yes.
Okay.
We'll start with you, Sonja. Yeah.
Absolutely not. Our family members are nowhere local, near. So we have no family in the area. And my friends don't live that close to us. So everything was just between the two of us. The dialysis units did offer respite, especially when I was doing everything 7 days a week. But they never followed through, and I didn't push the matter. When he ended up, if he ended up in the hospital for a day or two, that was the so-called break. You have to find something that works for you, because everyone's situation is different. You know, some people are able to do it through their community where they're paid to take care of someone, and they don't need to work outside the house. My situation was a little different. I had to work outside the house, and then we still had to do the dialysis and everything else that's involved once I came home. So you have to find what works for you. Some people, you know, they get up and they go out and they take a walk. Some people, you know, a good book, they stop and they just turn the world off and read a good book, or they might listen to music. But you have to find what works for you, because it's different for each individual. It's just finding that thing that works for you to kind of mentally tune out the whole dialysis situation and regroup mentally, and then keep going from there.
Thank you. I love that. And Verneeky, she was giving you applause for that. Verneeky, I'm gonna jump over to you and ask you, what do you do to take care of yourself? Oh, I think you are on mute.
Yeah. To take care of myself, I seek mental health support. I always make sure that I can schedule an appointment to speak with a therapist or another mental health professional, because sometimes those stresses get to be a heavy burden, and they're not something that you can always carry alone. So I feel like that's why those people are in place. And also I rely on, you know, the support of other family members and friends, you know, not adding that to their life, but just, you know, sharing that information with them, talking to them about it. And other resources that I use is just, you know, my spirituality side. I rely on a higher power by praying and trusting in God to help guide me along the way. And I also try to exercise to de-stress. I found out that that does relieve stress, and it promotes health. So I go for walks in the park, in the mall, during my lunch break, different times of the day. You know, I deliberately park far away from the building to get extra walking in. And I read. I find that reading is therapeutic because it not only relaxes you, but it stimulates your brain cells. It keeps your mind working, and it's giving you something constructive to do and to focus on. And it also helps to refresh your memory. So those are just some of the things that I do. There's others, but those are some of the main things that I rely on for my own support and my own resources.
That's wonderful. Thank you for sharing those. I think we all can take some tips from you and implement them into our own lives as self-care. So I appreciate you sharing those. We had a question come through, and I'm going to pose this first to you, Verneeky, of how has being a care partner impacted your personal life or goals?
Being a care partner has definitely impacted my personal life and goals, but I just learned to multitask as much as possible and to try to stay organized. You know, I even write to-do lists to help me keep up with things. I even keep journals and calendars, pocket size, that I can fit into my purse or into my business bag. And I take that on the road with me. And, you know, I try my best to reflect on that as much as possible when I have scheduled appointments or when my mother has them. I go into the book, I open it up, and I go in and check. And I write appointments down as quickly as they get scheduled. So I know a lot of people check out. When they check out, they get their next follow-up appointment. I'm the one that's at the desk and I'm writing it down right then so I don't forget to do it later. And I also ask them to put it on the appointment reminder cards. And another thing that I do that I find works is I ask for appointment reminders. I ask them to send me an email or a text message. Most healthcare provider facilities are really great at doing that. It's something that they offer automatically, and not many people are aware, but it's something that you can always ask for.
That's such a great tip. Thank you for sharing that. Sonja, I'm going to hop over to you and ask you the same question of how has being a care partner impacted your personal life and goals, if at all?
Well, I think the most important thing is what Verneeky just said, which is being organized. It is just so important that you keep totally organized. I used to have 2 books, one for him and a duplicate copy for me. And every day there were notes in there, what had to be done, what had to, because there's so much involved, especially when you're doing home hemodialysis, that, you might forget something. And so it's so important that you stay organized and you write down everything that needs to be done, even something that may seem trivial to write down. Yeah, it keeps you organized. It keeps you from making mistakes, and especially when you have a lot on your mind, sometimes you tend to forget. And if you don't write it down, it's a real hindrance. You really need to stay on top of things and write things down and stay organized. That's really the most important thing, because there's so much involved between the machine itself, between appointments, between the supplies for the machine. The machines break down. So there's just so many different things that you have to address. And you just can't remember them all. You have to just constantly take notes. And that's, I think, the most important thing is to stay organized.
Thank you. Appreciate you sharing that. Today on the summit, we have a host of folks, including many healthcare professionals, those that serve in the dialysis clinics, transplant facilities. From your perspective, what can the healthcare providers do to help new care partners adjust to their role? And I'll start with you, Sonja.
I think the lack of information. When you go to even in center, not just home dialysis, but in center, you don't get information until it's too late. So having the information ahead of time, knowing what to expect, knowing what to anticipate. The situation for each individual is going to be different depending on their particular situation. But when you do home dialysis, you need to know what to expect. There was just so many things that we were not provided. We found out by hit or miss, kind of what I call hit or miss. The situation came up and they said, oh, this is what you need to do. Well, that's, to me, too late. If you know these are things that can happen or may happen, these things need to be addressed prior to you doing dialysis. And that's the big thing. Even when you train to do home hemodialysis, a lot of that training doesn't put in a lot of information of things that you need to know. And you find out because a situation comes up and then you're like, what do I do? And they, this is what you should have done. Well, I need to know this now. And these units really need to make sure that no matter whether you're going in center or you're doing home dialysis, that you have that information prior to needing the information. So if they could start supplying that, that would be so beneficial to anyone, because there's a lot to learn as there is. So the more information you have up front, you can make better decisions on how to move forward and what to do that's best for your particular situation.
Thank you. Appreciate that response. Verneeky, same question, and it may be the same response as well, but what can healthcare providers do to help new partners in their role?
I think healthcare providers, to help new partners in their role, one thing they can do is offer their best expertise. They're well-trained professionals, and the majority of them have experienced challenges and successes in dealing with patients of all types or according to their specialty. So I think that they should just remain professional and be willing to provide some specialty attention if necessary, if they have to schedule a private session and speak with patients that may need that one-on-one time with the provider, or if they need a little bit of additional medical expertise, they may have to redirect them and say, hey, I need you to see a specialist, or some type of outside resource that they need to seek. But if they're willing to share their experiences, I think that's a great help, and that's very important.
Thank you. I love that. And there's some folks in the chat who are just so grateful for both Verneeky and Sonja being so honest and sharing their experiences. One of our last questions, and it could go both ways, and I'll start with you, Verneeky, since you were just speaking, is what has been the most challenging and what has been the most rewarding part of being a care partner? Verneeky, I'll start with you, if you don't mind.
Not a problem. So answering that question, what I think has been the most challenging in dealing with my mother and my role as a care partner is making that distinction and that separation between mother and daughter. At the beginning and the end of the day, that's always going to be our position. That's going to be our relation to one another. Nothing would ever change that. But just emphasizing the fact that she's also my patient as well, and that she does supervise the assistance that I provide for her. So just making sure that I can focus on the perspective of we're not only in dual status, but actually it kind of triples our interactions in interpersonal relationship and communication with one another. So I just have to keep that those perspectives in mind when communicating with her. All through the day, it's going to be patient to provider. And then outside of that, we're still mother and daughter. And those are the roles that I have to keep focused on in my mind. And then when I'm actually trying to relate to her. So that's the biggest challenge is getting that done.
Absolutely. I love that you pointed out all those different roles that you all play. And I think that goes back to what Jeff was saying earlier of sometimes family, it can be the most rewarding and also the most challenging having your care partner be related to you. And I appreciate you being so honest about that.
Not a problem. As my mom is here, she actually wants to make some comments, if that's okay.
Sure, we'd love to hear from her. Hi, Brenda.
Emma, how you doing?
I'm doing well, thank you. How are you today?
I'm good. I just wanted to add something to that. And like she said, the most challenging is that I'm also a consumer-directed patient through Medicaid. And what it is, I'm her direct supervisor. And she's also my care partner, which is my daughter also. Like she said, we're in dual status, and sometimes that prevents a little challenging for us because it's almost like it's business inside, like it's a regular job and it's business inside. So sometimes I suggested earlier years ago when she was taking care of me, because she was having a challenge differentiating between the two. So I said, when you're on duty, call me Miss Jackson sometime. And if that will help you transition a little bit from calling me mama, mama, mama. So we haven't quite got to that step yet where she wants to call me Miss Jackson, but it's fine with me. So we're working on that a little bit. And I think she was also trying to say that the most rewarding part is that I'm her mother, and it's challenging. I'm challenging because we're both strong-willed people, and but we love each other, and with working on with a lot of patience and understanding of each other. We keep getting up in the morning, speaking to each other, loving each other, and we keep right on going through the day. And she's been my care partner since 2012, and so far I keep trying to get her to go get another job, and she wants to stay right with mama.
Well, I just appreciate so much you all being so honest about your communication struggles, and you all have clearly come such a far distance from when you first started, and how you work through those challenges. So Verinda, thank you for your words of wisdom there, and Verneeky, you as well. We've got a couple more minutes, and I do want to pose this same question to Sonja of what has been the most challenging and what has been the most rewarding about being a care partner?
Well, my situation's a little reversed. I'm the mother and he's the son. So the challenging part is understanding that, he's an adult, and that one thing I learned when we start doing home dialysis, you get to, as the patient, you get to know your body. You understand the machine. And the great thing about home dialysis is you have flexibility with that machine. You can make adjustments to the machine in the middle of your dialysis treatment, which you can't do in center. And so he got to the point where he understood the machine and his body, and I had to let him go and make those decisions for himself based on the results that he was getting and what he was feeling. So it's a matter of, certain things you just have to let, from my perspective as a mother, had to let him make his decision and not make all the calls myself. The most rewarding part was the fact that doing home dialysis gave him things that going in center never would be able to give him. He was healthier. He stayed out of the hospital more. He had control over his dialysis, the time of day, and when he decided to do it. He had more liberty as far as his fluids and his foods. And, when it comes down to it, when you have a family member that's taking care of you, no one's going to take as good care of you as that family member. So the rewarding part is knowing that that person is getting the best care, and they couldn't get it any better than if they had a nurse come in, because you're going to do that extra for them that someone that's an outsider would not do. So that's the rewarding part, knowing the benefits that person is getting that they wouldn't get otherwise, either from some stranger or going in center. So that's the rewarding part.
That's beautiful. Thank you so much, Sonja. People in the chat are just so grateful for you sharing that. Sounds like you have a great partnership, and just like Verneeky and her mom, it sounds like you and your son have put in a lot of work to get where you are, and just try to understand your roles. So we appreciate you sharing that. I think it likely resonates with a lot of people who are on this call. So a big thank you to Verneeky and Sonja and Jeff for being here today. This was a great session. We love hearing from you all.
You're welcome.
We will continue to watch the chat as more questions and comments come through. We will share those with you all. But thank you so much for your time.